Hi everyone, I'm Dr. Barrett, and this video is intended for my patients exclusively. If you've had surgery by another surgeon, please make sure to follow up with that surgeon for particular details about your surgery. And if you're having a medical emergency, please dial 911 or go to the nearest emergency room. Congratulations on your rhinoplasty procedure. You're either about to get a rhinoplasty or you've just had it and you're on your way home. It's important to pay attention to all the things we talk about in this video to make sure that your postoperative process goes very smooth. First thing to note is that there's going to be a lot of swelling and bruising in the nose. This is completely normal. In fact, swelling can easily last up to 6 months, and in some cases in open rhinoplasty, it can last 12 months. I want you to take the antibiotics as soon as you get home. The Caflex, you take one pill 4 times a day, spaced out every 6 hours. Don't wake up in the middle of the night to take it, all right? Take one before you go to bed and one when you wake up until the bottle is empty. Now, if it's clindamycin, it's one pill 3 times a day until the bottle is empty. Remember, all the antibiotics need to be taken their full course. The only time I run into infections is when people don't take the full course of the antibiotics as prescribed, so make sure you do that. Next thing is the Colace. Take one pill twice a day until you have a bowel movement. Once you're done with that, you no longer need to take the Colace. All these medications can be taken on an empty stomach, so take them right away. When it comes to pain control, the CBD is the best option for this. You take a full dropperful, put it underneath your tongue, let it sit for a few minutes before you swallow it, okay? It's gonna absorb better that way, and take another full dropperful at nighttime when you're about to go to bed. When we take your splint off, it's normal to have swelling, it's normal to have bruising, and sometimes it can look slightly asymmetric if the splint is tight on one side versus the other. This is completely normal. It's also normal to have a little bit of drainage from the nose. It can come from the incision, it can come from inside, or it can come post-nasally. This is very common the first 24 hours, and that's why we provide you typically with a mustache dressing. Take a little bit of gauze and tape it underneath your nose to stop the flow of the fluid underneath your nose. It's okay to shower 24 hours after your rhinoplasty procedure if you feel like it. It's important to wash your hair and wash your face in a manner that doesn't get your nose and your splint wet. You can cover it with saran wrap if you need to, or you can just take a bath. It's important to remember that you might have that little scopolamine patch behind your ear. Take that off when you get home. If you leave it on, you might get blurry vision or you might get dizziness. It's important to take it off with your fingers or with gloves, and make sure not to rub your eyes after you do that because it can cause blurry vision when you rub your eyes. You want to sleep with the head of your bed elevated at nighttime for the first 2 weeks. This can be accomplished with some extra pillows. You don't want to sleep on your face or on your side at first. In the first 48 hours, you can use ice intermittently. That's basically on for 15 minutes and then take a break, 5 to 15 minutes, and then put the ice pack back on. If it's hurting or things are going numb, you're doing too much ice. And again, this is to help control swelling and bruising the first 48 hours of the first 2 days. Also, make sure to change the dressing underneath your nose frequently as it gets bloody or discharge accumulates on it, all right? We want to change this at least daily to prevent accumulation of excess fluid. Most important thing to do for your nose is to use a saline mist at least 6 times a day. You're going to take 2 sprays up each nostril to allow the bloody fluid and the dry areas to get moistened and remove some of that excess buildup. Don't use any Afrin, just saline mist will do the job perfectly. You can also clean the area of an open incision with Q-tips and hydrogen peroxide. Use a very low concentration of hydrogen peroxide, or if you don't have that, just a little bit of soap and water would do the trick. Stitches will be removed at your first postoperative visit, and there's some internal stitches that sometimes get removed at the 2nd week. Your splint will be removed at the 1st week. That includes the external splint, if we used one, and internal splints, if we used one as well. Following removal of the tape and splint, it's important to wash your nose gently to prevent oily buildup. If you wear eyeglasses, it's okay to wear the eyeglasses on top of the splint, but once your splint is removed, you can either go back to contact lenses at 1 week or suspend the eyeglasses from your forehead without it touching the bridge of your nose. This can cause indentations of your bone as it's healing. Retainers and any mouth appliances can be restarted at 2 weeks after your rhinoplasty procedure. No contact sports for 3 months. No driving for at least 1 week after your rhinoplasty surgery. Use a baby toothbrush on the upper teeth the first week after your surgery. Avoid blowing the nose or sniffing heavily through your nose for the first 2 weeks. No pullover clothing for the first week after your surgery. So I want to talk to you about some products that you should be taking after your surgery. It's really important to help you heal and help manage your symptoms. The first one I love is CBD. Okay, I recommend this product, Wild Health CBD. You take a full dropper, put it underneath your tongue right when you get home, and a full dropper right before you go to bed. You can actually increase as needed. You will sleep like a baby, and it'll actually calm your anxiety and calm down your pain to a manageable level. Magnesium is a great supplement for three main reasons. First, it helps control the muscle spasms that you get can be experienced as pain after surgery. Second, it helps with constipation, helps keep you regular. And third, it helps you sleep at nighttime. The best way to take this is 2 of these capsules at nighttime right before you're about to go to bed. Arnica, this is a product we recommend. It has arnica and bromelain in it, so that helps the swelling go down naturally, and it helps the bruising. What else do you need to take? Well, there's a product I also recommend. It's called Heal Fast. It's a vitamin supplementation that's designed to help you heal right after the surgery so that your body has the necessary nutrients to heal. You need to take 5 of these twice a day. I know that's a lot, but you need all of these nutrients to heal and to detox your body from the anesthesia. The other product is Masszymes. It has a whole host of enzymes, digestive enzymes. You want to take 4 of these pills with every meal to help break down the food and help decrease your body's inflammation so that you heal faster. You can absorb the nutrients and it decreases inflammation in your body. This stuff has been proven to speed up your recovery. It is a must if you're going to have any surgery by me. Lastly, Scar Gel. Pick up the Scanuva Scar Gel. You want to use this on your incision twice a day. The reason why I like it's got silicone and a bunch of other fetal growth factors that help the incision heal. Plastic surgery is a stressful experience on your body, and oftentimes we prescribe antibiotics. That's why I recommend the Probiotic 225, which is a powerful, doctors-only probiotic that you can take to help restore your gut flora and fauna after your surgery and after any antibiotic use, okay? There's packets in here. You use 1 a day. You can mix it into cold water. You can take it with antibiotics at the same time. And you want to take 1 packet each day for at least 2 weeks, which is normally the amount of supply in each box. We recommend that you get one of our post-op recovery kits. It has everything you can possibly imagine you'll need after surgery, including gauze, medical supplies in here, saline, hand sanitizer, sleep mask, earplugs, you name it. It is personally picked out by me so that you have everything you need to heal and recover and take care of your body after surgery. It's important to walk right away after your surgery. This is not strenuous walking. This is gentle walking, less than a mile every day. I recommend a minimum of at least 3 times a day, a couple minutes each session. It's important not to do any heavy lifting for at least 3 weeks. Don't do any bending over maneuvers that increases the blood pressure to your head and to your nose. Don't chew hard on any significantly difficult foods to eat or open your mouth extensively wide like that for at least 2 weeks. Normal body temperature varies from 97 to 99 degrees. If you get a temperature of 101 or more, I want you to give us a call, okay? That could be a problem. Significant drainage from your incision, we're not talking a little bit of bleeding, but if you're getting pus draining out from your incision, that's something we should also be made aware of. If you haven't urinated in 12 hours after your surgery, you need to give us a call or call 911 or your nearest emergency room. If you are persistently nauseous, vomiting, and you can't keep anything down, you need to give us a call 911 or go to the nearest emergency room. Congratulations on your rhinoplasty procedure. Follow all these instructions in this video and you're gonna do great. Remember, it's a long process of swelling and healing, but hang in there and you're gonna love your result. Make sure to tag us in your recovery journey, all right? #BarrettRecovery is the best way to share your experience so other people can learn from your journey.